Hello, I'm Julia Seymour from the Market Herald Studios. Interpretation of medical images has typically been considered exclusive to healthcare professionals. However, thanks to sophisticated technology, one company is bringing this ability from the practitioner to your pocket. Today, Singular Health has announced the release of 3DICOM Mobile, a mobile app which puts patients' CT and MRI scans directly in the pockets in 3D. Here to tell us more about the launch is Singular Health's Chief Executive Officer, Thomas Handley. Welcome, Thomas.
Thank you. Thank you for having me.
So what can you tell us about 3DICOM Mobile? Where did this idea for the application come from?
Well, look, originally the company developed a 3DICOM viewer for virtual reality, then extended that technology to the laptop so it can now view it in Windows and Mac. But we realized at the very beginning that it wasn't going to be something that the average consumer was going to use a lot of unless it went into the mobile application. So the idea of the mobile application is it creates that interface, that communication dialogue between the practitioner and the patient, and in some cases between practitioner and practitioner. Early in the piece, we realized that a lot of practitioners use mobile phones to communicate. They use iPads, tablets, those sort of things, and are moving more and more away from just the average desktop. So really, this has been a very sort of key element of getting our technology into a format that is used by virtually every person on the planet.
So how exactly does the app work? Is it simple for patients to use?
It certainly is simple. So most people who get a CT or an MRI scan will go into the clinic, they'll sit there, they'll lay there, the scanner will do its thing, and then at some point they'll get an email. And that email will say, if you use this app, you can see your images in 2D. So you'll see those individual slices. And to the average person, even to some clinicians, it doesn't mean a lot, right? When you look at those two-dimensional slices, you're not really seeing much of what you can recognize. At that point, it's virtually impossible for a patient to see that in 3D. There is no existing software platform that is easily accessible that enables that person to then claim their DICOM file and use that in a 3D format until now. So the very first part of this was the release of our medical file transfer protocol. And that was really important because it's about getting those DICOM images, those CT MRI scans, onto a device that is both easy, quick, and yet really, really secure. So we can maintain that security, we maintain that patient confidentiality, but at the same time, we make it easy to transfer those files from app to app or from device to phone. And then once that's done, and in fact, using that medical file transfer protocol, it's as simple as a QR code that appears on the TV, on the computer screen. You hold your phone up to the screen, you verify that that's who you are and that you are able to access that information. And within less than a minute, that then appears on your phone in that sort of wonderful 3D image that anyone can recognize and understand.
So Thomas, if I were to enter a clinic today, can you give me a bit of a demo of what we would see with the app?
Absolutely. So at the moment, inside the clinic, your doctor or clinician would be showing you this scan. This scan at the moment is of a heart scan. And as you can see on the far right-hand side, you can see the multiple two-dimensional views of the heart, and then our reconstructed view of the heart in 3D in the middle of the screen there. The important step, of course, is we now go and transfer this image to your mobile phone. So the important thing here is we hit the scan button, up pops a QR code. And as you notice in here, this is backed by a medical file transfer protocol. There's the private blockchain that records every single transaction. So anytime anyone clicks on that QR code, that is recorded in that private blockchain for security purposes. I then go to my phone. It then says scan a QR code. I go onto there. Scans a QR code, wait a moment, and the heart scan pops up. And what you'll see on this phone is what you've seen on here. And this is, again, the important ability for that patient to take this home with them, not just to communicate with other medical professionals, but that really important step of communicating their diagnosis or their treatment or their recovery with individual family members or friends.
How does the use of this application generate revenue for Singular Health?
Well, it generates revenue because it's part of the ecosystem that we keep talking about, the sort of scan to surgery ecosystem. In fact, Singular Health has two sort of key areas that it's focusing on for revenue. One is the patient engagement, patient education element of the application, and the other one is this really important scan to surgery. So for this to generate revenue, what it does is it brings the workflow into a very, very simple process so that a clinician, when they download 3DICOM Viewer on their Mac or their workstation. They're paying in order of sort of up to $30 a month to utilize the software on here. It then enables that person to share that information with their patient. And without that sort of sharing of that information with a patient, it sort of disrupts that whole sort of ecosystem that we're trying to create. That sort of informed ecosystem where a patient is sitting there, not just talking with their doctor, not just understanding the procedure or the operation they're about to be performed, but then able to take that image home with them and sit down with their family, right? So whether it's something as simple as removing a wisdom tooth or a spinal surgery or a cranial mandibular surgery, they can now go back to their family at home or for their friends and family, sit down, go through the scan and understand exactly what that operation is going to be. So it creates an important step in assisting the surgeon or the clinician to educate that patient and that of the particular outcomes they're looking for.
Certainly a very important milestone for Singular Health.
Very important. Thank you very much.
Thanks for joining us today, and we hope to see you back again soon.
Great. Thank you.